If you make the wrong decision early on without the right team around you, your product might not be manufacturable at scale. It takes a village to make a new therapeutic product. Failure is a necessary component, and it's very useful as long as you learn from it.
Thank you to the International Society for Cell and Gene Therapy for supporting Onyx Live. I am Federico Citteric reporting for Onyx Live here in Dublin at the ISCT. Today we're joined by Sullivan, founder and managing director at Lindville Bio. Stephen, good afternoon. Thank you for joining us first of all.
My name is Sullivan and I work for a consultancy firm, Lindville Bio, and basically we specialize across a range of different areas like CMC and the business and science of iPS cell therapy development.
I'd say a good focus on pluripotent stem cells.
Yes, exactly.
Why is it important to focus on that?
Well, I mean, ultimately, induced pluripotent stem cells, the science is very complicated. We're understanding what we need to kind of get the cells to grow and maintain their functionality while still being able to produce any cell type of the human body. And that kind of basically subverts one of the main limits to understanding human disease and development, namely getting enough material to study. So the idea is not only are these iPS cells the foundation of therapeutics, but also they'll tell us more about how disease actually happens. So you've got disease in a dish, and we can make these iPS cells relatively straightforwardly now from patients with different diseases. So I think it's a very exciting time for personalized medicine in the years to come. I mean, I know the world is in, an interesting period, shall we say, but I've never been more excited about the pluripotent stem cell field, and I've been in it for over, 20 years now.
A long time.
So, yeah.
Across the companies you work with in this field, where do things, I'd say, most of the times go wrong?
I think paradoxically at the beginning, because early developers like academics in university, they're forced to make decisions, and those decisions have downstream consequences. And if you make the wrong decision early on without the right team around you, doesn't matter what choices you subsequently make, your product might not be manufacturable at scale, or ultimately it might not be able to produce a therapeutic product that is, fit for purpose to get approval and subsequently be used in many patients.
So the very start is a really
particular huge thing. Like it's not particularly in the handoff between basic research and translational research. So you'll find a huge kind of lack of understanding about words in a GMP context, when they mean something very, very specific, and words that are used in kind of basic research. Because ultimately, basic research is about discovery. When you get to kind of translation, it's more about consistency and making sure that the product is consistent and fit for purpose.
So just to sum this concept up, which is, I think, really important also for the companies watching us, what would you say to someone who is entering this space for the first time? What would you say is the first advice, which is perhaps one of the most important?
Well, I think a classic problem is thinking because you're proficient in one area that you're proficient in all areas. And just because you're very good a basic researcher does not necessarily translate into the idea that you will be a good translator. So you have to, basically have a degree of humility and build a team around you with the necessary skills that you lack. And no one can do it all. Like a very common expression that we hear at ISCT and related meetings are, it takes a village to make a new therapeutic product. And that's really, really important. So you have to have a really deep understanding what the regulators are looking for. You have to understand the choices that you're making from the point of view of, material selection, so that ultimately you have a high quality starting material, which will then be the foundation for a high quality, therapeutic product. And ultimately, unlike kind of, for example, small molecules where you have a degree of wiggle, shall we say, in terms of like, you can sterilize a small molecule at the end of a process. When it comes to using cells and cell therapies, sterility needs to be maintained throughout the whole process. So you really have to, think long and hard about the process you're going to use that's going to get your quality starting material into a quality, final therapeutic product. So you have to do a lot of thinking up front.
You mentioned regulators, which is, of course, one of the hot topics. So from your experience, where do you see the biggest differences in how regulators around the world think about pluripotent stem cell-derived therapies?
Well, I think the first thing I would say is you'd be quite surprised by how many people do not fully understand what the regulator does. So like the regulator is not there to align the field. They're not there to make sure that the field flourishes in a commercial sense. Their sole responsibility is to make sure that the patient is not exposed to unnecessary risk, right? So like their whole focus is on risk and making sure that patients are not exposed to unnecessary risk. There's a lot of early developers and various other stakeholders that think it's, the regulator's job to make sure that the industry thrives. And that's actually our responsibility as developers or, as consultants to developers, that, we're making the right play here so that, not only will the regulator be happy and give approval, but also that you have a therapeutic product that's fit for purpose and has a commercial market. So all these things feed in together. Like, I started off in academia with pluripotent stem cells. Then I spent many years understanding the problems associated with scalable manufacturing and developing a consistent therapeutic product from pluripotent stem cells. And then on top of that, understanding how business feeds into this, and ultimately, how does one attract investment to be able to make this complex but ultimately very useful therapeutic product.
Stephen, we are here in Dublin at the ISCT, which is coming to an end. How long you've been coming to this conference for, and what topics this year you've been talking about? Did you see any evolution over time?
Well, I'm Irish, so I'm very proud to host ISCT in my native country. I mean, a lot of attendees who are at this conference also attended the Guinness warehouse. And there's a classic example of, Guinness not only produce good beer, but they produce it at scale and in a consistent manner so that, people can enjoy Guinness throughout the whole world. So, I think it's very interesting to think of cell therapy in that context, and ISCT is at the forefront of trying to make that a reality. So you take something that might be a microbrew at the beginning and work in a small number of labs, but make it consistently so then, it's something that gives rise to a final therapeutic product that can have a real clinical impact in many thousands and, tens of thousands and of patients worldwide. And that's really what the field as a whole needs to move towards in order to, have financial viability and societal support for, the kind of complex endeavors that we're trying to, support within the society.
At conferences like this, people often tend to tell their positive story. But as a consultant, do you think they should also focus on the challenges a bit more?
Well, I think, the one thing I would say is that when you go to America, and I spent many years in America, you realize that when you're in this profession, failure is a necessary component. And it's very useful as long as you learn from it. So like failure is a necessity in order to get a new therapeutic product to market. But, you hear these expressions like fail fast, fail often, and that's actually really quite important. You don't want to go 99% of the way through developing a new therapeutic product only for it to fail at the very beginning. Then you use up a huge amount of resources, a huge amount of, staff contributing their time to things. So, I think the kind of people that really excel in cell therapy are the collaborators who are humble enough to realize, okay, my area of expertise is here, but it doesn't extend into this area. I need to build a team with a bona fide expert in that area. And so that's really kind of, we think an awful lot about the technology, but the people are as important as the technology to, getting things over the line. So you do really see therapeutic benefit for the patient at the end of the day.
That's really good advice, I think. Stephen, thank you very much for
Thank you.
joining us, for your time.
Thank you.